This will be outstanding as we welcome the Honorable Commissioner Royal, in company of the U.S. Consul General to Federal Republic of Nigeria. Welcome, sir.
Try to find out where they established the protocols, and then I stand there. And then I can say I'm standing on existing protocol. Wow. What a lucky the people of RiversState are to have such an incredible Commissioner of Health. Thank you. Thank you for your kind words. Clearly, you know your brief and you know your issues. And to me, that is the sign of good governance. Government that delivers for its people, right? A government that takes care of its people and watches out for its people and builds the next generation. We just hosted Secretary of State Blinken last week in Lagos, and he was in Abuja. And the message he brought from the president is the partnership that the United States has with the African continent. And I'm very grateful for your kind words of gratitude, but it's not about us giving to you. And that's the point I want to make today. It's about us working together. Secretary Blinken said it so profoundly. He said, Africa has shaped our history. Africa is shaping our present, and it will shape our future. Which is why the United States has been so committed to partnering with the continent. And if you're going to work with the continent, you need to work well with Nigeria, right? Working with this beautiful and amazing country to find a path forward on the challenges that face us. Be they climate change, be they health issues, be they the vexing problems of youth unemployment. How do we work together on these problems? And how do we solve them together? So I'm really, really grateful to be here. I love these programs. I love seeing how we're working together to help save lives because, yes, I just did a visit to, obviously you're in RiversState, so you have tremendous natural resources. But your greatest resource are your people, right? And when we talk about Nigeria, we're talking about the workforce for the world, right? The average Nigerian is 19 years old. So how are we making sure that they're healthy, that we're building the health systems that we need to build and put in place so that they can have a future? And this is why I'm so excited to be here today. See, I knew I was going to start all the way over there and I was going to get done today, I promised. We're here to talk about preventing mother-to-child transmission. No child should be born with HIV/AIDS. It's preventable. And the work that you're doing here is preventing that. And the incredible testing and support that you're giving to your mothers before they give birth and then afterwards is ensuring that the next generation doesn't have to face those threats. So thank you. And I see so many doctors in here. So first of all, I'm not a doctor. And it's a little intimidating to be with so many doctors. But I want to say thank you because two things about me. One, I really begged to come do this job in Lagos because I wanted to be in Nigeria because I love Nigerians. I've met Nigerians all over the continent where I've worked. And interestingly, when you meet a Nigerian outside of Nigeria, you say, "Where are you from?" And they say, "I'm from Nigeria." When you meet a Nigerian in Nigeria, they say, "I'm from," in the insert state, I'm an Igbo man, or I'm from Kwara, or I'm from, So I love the people and the incredible potential. So asking to come here and be part of that partnership and work together is something I was just absolutely wanted to do. I'll tell you the second thing about me later. But I just really, really grateful to be here. I want to go see the incredible work you're doing, and I want to thank you for your sacrifices. Living through COVID-19, I was on the continent. I was in South Africa, and watching HIV/AIDS programs just go when COVID hit. In almost every country where we have large PEPFAR programs, which is the program we use to talk about our HIV/AIDS funding, we saw dramatic kind of steps back in the fight. And the only place that didn't seem to happen was right here in Nigeria. You managed to use the systems that were put in place under PEPFAR, the testing and the treatment systems, and said, hey, let's use these and quickly pivot to how we can identify COVID, and now broaden the aperture to look at how we can look at other diseases. And that holistic approach to solving problems is going to be absolutely necessary as we start to pivot towards more of a partnership and less of a donor relationship with the Nigerian government. So it's something that we're keen to talk about, and I'm really, really grateful to be here with you. So thank you so very, very much.
Thank you very much.
United States Consul General to Nigeria, the Permanent Secretary of the RiversState Ministry of Health, and the CMD of the RiversState University Teaching Hospital. Permit me, everyone else, very esteemed people who are here, directors, partners in this journey towards improving healthcare access for all in RiversState. It gives me great pleasure to welcome you and your team to RiversState today, and especially to the RiversState University Teaching Hospital, a facility which the United States government has supported since 2019. And I'll go through some of that support. In 2018, there was a national HIV/AIDS impact. Meant was that RiversState then had to be categorized as a high burden, a low saturation, and a prioritization state for intervention. And what this then led to was the birthing of the SURGE project, which has been referred to since you came in here today, with Institute of Human Virology of Nigeria in 2019. Of course, with technical support from the United States Centers for Disease Control in Nigeria, with funding from the United States government to support AIDS and STI control program in our state. And basically, this was supposed to close the gaps in testing, gaps in treatment access, and of course, viral load suppression. So from 2019, in April to be exact, the project, since 2019, the project has achieved several things. The first being the provision of enhanced HIV testing services to over 4.8 million people in RiversState, especially in those local government areas that have a very high number of persons that are living with HIV and AIDS. So these services were taken to doorsteps of residents in their various communities, in addition to the traditional method of HIV testing in the facilities. And so there's been an increase in the number of facilities providing antiretroviral therapy. As at the time the SURGE project commenced, there was 88 facilities and has grown to 114. And then there's also been an expansion of prevention of mother-to-child transmission of HIV services in these same communities, therefore reducing the burden for children. There's been commencement of ART, antiretroviral therapy, for over 140,000 people living with HIV and AIDS, making it a total of people who are receiving treatment in the state to 166,767, an increase of 83% from the time when the project commenced. So the test and start model, which is in use, was routinized with scale-up of community treatment initiatives, an expanded flexible clinic hours, and multi-month dispensing of medication, which we know helps with adherence to treatment and just makes life generally easier to bear for those who have to take the medication. And so if we look at it from the context of the UNAIDS targets of 95, 95, 95, RiversState is actually at 94, 98, and 83, meaning 94% of people know their status, 98% have been placed on treatment, and 88% have viral load suppression to undetectable levels, which is a significant growth from the start of this project. And I thank the United States government for the tremendous support in this regard. There's also been strengthening of laboratory services with the installation of 2 PCR machines here at the RiversState University Teaching Hospital for viral load testing and early infant diagnosis, with viral load testing services offered to over 155,000 people living with HIV and achieving a suppression rate of over 95%. There's been enhancement of strategic information with the deployment of patient biometric systems, enabled electronic medical records systems and echo platforms in over 115 facilities and 43 facilities for echo, respectively, in the state. And this, I know the CMD referred to in terms of the high performance of this facility, the Rivers State University Teaching Hospital, in terms of the quality of data that is collected and captured. There's also been the clinical mentorship program, something we're very, very proud of, that was first piloted in Rivers State and has now been adopted by the Federal Ministry of Health as a national program, and trained health workers for the improvement in service delivery. And so on this note, I just want to say that as I represent His Excellency, Governor Siminalayi Fubara, the Governor of Rivers State, we would like to convey the appreciation of the Rivers State government to the people and the government of the United States for this support that has helped us to close tremendous gaps, significant gaps in the management, in the care that people living with HIV and AIDS receive in Rivers State. The impact of this is that having more people know their status, having more people placed on treatment, having more people with viral load suppression helps in that journey towards destigmatizing the illness. And this is something that is very key to the focus for Health for All in Rivers State. And so on that note, we welcome you to Rivers State, and we will proceed on the other parts of your visit that will further highlight the significant support that the Rivers State government has received from the United States government as we continue to fight HIV and AIDS and ensure quality life, health, and well-being for those who are living with the infection. Thank you very much.